Let's break down two high-yield NCLEX topics that I have seen all over the NCLEX lately. It's been in almost every list, especially the first one. So make sure that you watch this all the way to the end. All of these buttons for me. I'm going to tell you exactly what you need to know. No more, no less, no fluff. Let's go. So the first one is otitis media. What is that? An ear infection. What is the NCLEX really checking for? First, with otitis media, the infection is in the middle part of the ear, usually caused by an upper respiratory infection. Eustachian tube that's in the middle part of the ear, it gets swollen and fluid gets trapped. Bacteria loves warm places. So what happens? An infection. Look for these signs and symptoms on the NCLEX. Bulging red tympanic membrane. That is the hallmark sign. If the mother says that the child has been pulling on the ear, they have a fever, they cry more when they're lying down, that is a sign of otitis media. Pick up on those things in the question. Here's your priority intervention going to be pain management and antibiotics if it's bacterial. Remember, antibiotics don't work on viral infections. And we all know that amoxicillin is the classic medication for ear infections. NCLEX loves to ask, do we put anything in the ear? Q-tips or eardrops? No eardrops, unless those eardrops are specifically ordered. And also no water in the ear during an ear infection. Those are the teaching things that you need to make sure that you're teaching on the NCLEX. That's what they want you to know. The next one I'm going to go over is strep throat. This is a group A strep that infects the pharynx, causes inflammation and a risk for some major complications. NCLEX symptoms you need to pick up on is sudden severe sore throat, fever, but no cough. That is the difference between bacterial and viral. Priority care is start those antibiotics immediately because you need to prevent rheumatic fever and glomerulonephritis. Those two show up on the NCLEX almost every single time. What you need to teach the parents is to change out that toothbrush after 24 hours on antibiotics and no sharing any drinks. What is the real NCLEX trick? They want to see if you can pick up on the complications and the why behind your interventions. You can't just memorize the symptoms. You have to critically think on the NCLEX like a nurse on the floor. If this breakdown helps you, imagine having every high yield topic broken down for you just like this. I make it simple, easy to understand, and retain the information. Grab my SimplyNCLEX and my study notes. They're at the top of my page all the time because I go over patho, test-taking strategies, exactly what the NCLEX is looking for without overwhelming you. But if you want to pass faster and you want to go into your NCLEX with less test anxiety and more confidence, you need to go grab SimplyNCLEX right now. Make sure you like, save, share this out. I hope this helps and happy studying.